In your MCQ discussions regarding thyroid and adrenal, you have mainly covered how to solve a lengthy MCQs within a short span of time. Just picking up some highlighting points, you have made that approach very easy, sir, in your MCQ discussions. Most of the topics, they are not there in Harrison, sir. You have covered from Williams, Deep Roots Endocrinology, from different books, sir. So it was very helpful, sir. Your MCQ videos were truly helpful, as your videos are very concise, each one for less than 1 hour, nearby 1 hour, 50 minutes to 1 hour. I used to hear a video at a time, sir.
Hello everyone, my name is Dr. Mayur Agrawal, Marrow faculty for Endocrinology. I welcome you all in this session. And today we have very special guest, Dr. Ravindranath is with us today, and he is rank 3 for AIIMS this year INI SS Endocrinology exam. So I welcome you, Dr. Ravin. First of all,
Thank you, sir.
congratulations. You
Thank
have
you, sir.
done really good. Your hard work has paid off. Now you can go to the AIIMS and the most reputed institute in India and in one of the topmost branch, I would say. So
Thank you,
let us
sir.
first know about you. So like from where have you passed your UG, PG, and just tell me about you.
So my name is Ravindranath Reddy, sir. I did my MBBS from Karnool Medical College, Karnool, Andhra Pradesh, and I also studied my post graduation MD General Medicine from same institute, sir, Karnool Medical College, and
Okay,
I
so
completed in August 2021, sir.
okay, so like recently you have passed. Okay,
Yes, sir.
so
Yes, sir.
like first, why did you choose to get into this endocrinology?
So my interest in diabetology, sir. Diabetology and thyroid diseases and bone disorders, osteoporosis. That had driven me to choose an endocrinology as my dream branch, sir.
Okay. So, did you have any exposure during your PG times in the endocrine department? Do you have endocrine department in
Yes,
your
sir.
medical
Yes,
college?
sir. Yes, sir. We have endocrine department, and we are having one professor and assistant professor, sir. And
Okay.
I have been posted for 1 month in my department, sir, during my
Okay.
PG days.
So you have like a wide view that how the endocrinology works. So when
Yes,
did
sir.
you actually start preparation for DM endocrinology?
My proper preparation was started in October, sir, last year, 2021, October, November 2021, sir. When they gave date for December INS at 2020, January 2022 session, sir.
Okay.
Then I started my preparation seriously, sir. And initially, I just studied my the Harrison part, and in Williams endocrinology, I have studied just the tables and important topics, sir, for the preparation. And in last INS at Jan 2022 session, I got rank 32, sir.
Okay.
And next in January NEET SS, I got my rank 180, sir.
Okay. So, like, how much do you think that time should be devoted to prepare? That's a common question for all the students. Like, how much time is needed for preparation? Like, at least this much months I need to prepare to crack the exam. So, what do you feel about that?
So my suggestion is at least we need 4 months of dedicated preparation, sir. As now INA set paper, it includes both general medicine part as well as specialty part. We have to equally concentrate on the general medicine part, sir. That was the mistake I had done in my NEET SS, sir. I purely concentrated on endocrinology part and I merely neglected the general medicine part, sir. And out of 40 questions, most of the questions in NEET SS were from neurology, sir, in my part, and I couldn't do well, sir, in my NEET SS.
Okay.
That was a main drawback what I noted, sir. So
Okay.
as we have to study both specialty and medicine, we require more of time, sir.
Dr. Ravin, we also like to know, like many of the students have a question that whether we should read from Harrison only or Williams is a must, or have you read some of the topics from Williams which you thought that they are really helpful and should be read from Williams?
So the topics like complications of diabetes and more of pediatric endocrinology part regarding rickets, uh, uh, vitamin D resistant rickets, and of other pediatric endocrinology part like disorders of sexual development, These are given very clearly in Williams, sir. I think they should be read from Williams, sir. And these multiple endocrine syndromes and autoimmune polyendocrine syndrome, they are more of clear in Harrison, and it's good. Harrison is sufficient for these disorders, sir.
Okay. And what about like tables? Because many of the questions, one-liners are directly picked up from the tables of Williams. So did
Yes,
you
sir.
go through them?
Yes, sir. Tables, I have gone through most of the tables from Williams, sir, as the questions were directly picked. And in this NEET also, this INSET also, we got so many questions from this tables, sir. We got
Okay.
at least 5 questions, I guess.
Okay. And regarding Marrow, how did you come to know about Marrow? Like, did you use in PG also?
No, sir. No, sir. I didn't use even during prior INSET exam and during prior NEET. And when I got our ranks in NEET SS, in February or March, my friend recommended me, sir, Marrow, and he gave he had joined in his dream branch nephrology, and he gave me suggestion to just go through some Marrow videos. It would be helpful, sir. He gave me his subscription, so I have gone through your test and discussions in those,
Okay. So, like,
and
how
it was.
many of the videos have you watched? Like, could you complete everything, or have you watched some
No,
selective videos for the super specialty?
I have just covered endocrinology part, sir. I couldn't watch entire medicine part. Medicine part, I purely concentrated more on Harrison, sir. And endocrinology part, I have watched most of your test and discussion MCQs videos, sir. Almost all. And regarding pediatric endocrinology part, some of Nalini ma'am's videos also I have watched, sir. Like
Okay.
rickets and disorders of sexual development. Those videos I have watched Nalini ma'am's videos, sir.
Okay. So, did you find it useful whether these questions did this discussion helped you to solve the question at that moment?
Yes, sir. Yes, sir. Sure, sir. For sure. Because in your MCQ discussions regarding thyroid and adrenal, you have mainly covered how to solve a long, lengthy MCQs within a short span of time. Just picking up some highlighting points. You have made that approach very easy, sir, in your MCQ discussions. I found that very helpful, sir. And most of the questions from your MCQs were controversial questions, and we could get some correct answer for those controversial questions, sir. And also, most of the topics they are not there in Harrison, sir. You have covered from Williams, Deep Roots Endocrinology, from different books, sir. So it was very helpful, sir. Your MCQ videos were truly helpful.
So we have tried to cover the MCQ in a way like we see patients, so that you get a feel that that is how the examiner actually asks. So that is what we are trying to give you an edge over other students. Also, how did you revise? Because see, it is easier to learn, like easier to read for the first time and even to watch the videos. But how did you revise? That is a common question by the student, because at the end, at last moment, to recollect everything, this becomes really tough.
I have noted all the important points in a short notebook, sir. In a short notebook, I have noted all my important points from your MCQ discussions and also from my Harrison as well as Williams tables. And also in Harrison as well as Williams, I have marked with markers, sir. There's some important highlights which I should study. I should be studying in the last 1 week, because endocrinology is nothing but numbers, as you say.
So,
I
yeah, it is slightly tough, and especially in those 1 minute or 2 minute you get to solve the question, to recollect
Yes.
everything is slightly tough until unless you have revised it many times. So, like, how many time did you give for videos and for theory?
So, theory, I didn't correctly share my time, sir, but I have used at least 3 hours a day for videos, sir. Not more than that.
Okay,
3 hours
because
video. Just I used to
yeah,
see
because
only
many of the
MCQs.
students feel that it's like really lot of information. So to digest that, it's slightly tougher. So what is your take on that? Like, did you feel that it was overburden for like, or you could go for 3 years easily and you could remember all those things?
No, sir. I used to not listen at test stage for 3 hours, sir. As your videos are very concise, each one for less than 1 hour, nearby 1 hour, 50 minutes to 1 hour. I used to hear a video at a time, sir. sometimes at least 30 minutes. I used to listen for 30 minutes, make a notes, and used to take again a break of 2 3 hours. And I used to study, and again I used to go for videos.
Okay. And one more important question is regarding the stage 2 of AIIMS, which you have cleared. So, was it different? Any preparation was needed for that differently from the previous theory exam?
Not completely, sir, but some practical points, yes, sir. From some practical points, we should be studying from Bansali's practical concepts endocrinology, sir, as we were asked more of practical concepts which we'll be treating patients. While we are treating patients, some of the practical questions we'll be facing, those questions were picked up and asked, especially in the stage 2 interview, sir. We
Okay.
were not asked direct textbook questions in that interview, sir.
Okay. And what is how do you infer this, the change in pattern? Like, is it good, bad, and what would you suggest for the future endocrinologist? That how should they prepare for that?
Surely for me it was bad, sir, because I studied more of endocrinology. I have neglected medicine part. It was bad for me last time. So after January session, I more concentrated more on medicine part, sir. Half of the time, more than half of the time, I used to read only medicine, and I had placed my time very less time for endocrinology parts. This
Okay. Okay. And before we end, like any inputs from your side that, okay, this should be included in Marrow videos and this would be more helpful for the candidates?
Mm, no, sir. Videos, your MCQ discussions were more than enough, sir. I say on my take, your MCQ discussions they helped me a lot personally because you added more of lengthy questions and controversial questions. You have covered everything almost possible, sir.
Okay. So thank you for giving your time, and to all the students who are preparing, I believe it's not really tough if you give your time and if you're firm enough, if you're determined enough, if you're enthusiastic enough that you want to crack the exam. It is really easy. There are some basic concepts which we have covered, and even if you'll just read once and you'll go through the videos once, they are not, they're merely say 20 hours MCQ discussion at max. Almost, I believe 70% of the questions can be cracked from that itself. uh, I believe Dr. Ravin, what is your opinion on this?
Yes, sure, sir. 70% of the questions you have covered, except from Harrison part. Most of the conceptual questions have been covered in MCQ discussion, sir. And INSET is they are asking more of conceptual questions, sir. And last INSET they have asked more of bone questions, sir. Entire 40 questions were from bone parts, sir. And in this INSET, there were more of syndromic questions, sir. They have
Yeah.
covered entire syndromes.
Yeah. So, like it's more of now they are moving from one-liners to more of conceptual question, the clinical
Yes.
question, the patient you see. That is what they want to know. So, obviously, any student who has seen the patient gets an age, but there are very limited of institute where actually endocrinology department is there and they have the exposure. So, we have tried to create that environment that you do understand that how the patient is seen and what all algorithms we apply, how to see a patient, that is how to approach a disease, how to make a diagnosis, and what all investigation you need and what all treatment is there for that disease. So that is how we have framed all these questions, that is how we have created these clinical videos. So this will be giving an edge to our students. So thank you for listening, and I again congratulate Dr. Ravin, and you have really done well, and also you have break the myth that only doctors from premier institute can go into AIIMS. So that is also a very big question, big dilemma in many of the students mind. So that has also been broken now, that yes, we have now Dr. Ravin here who has cracked the AIIMS super specialty exam endocrinology this time. So congratulations again. Thank you.
Thank you,
Thank
sir.
you for this
Thank you.
opportunity. Okay,
Thank you,
thank you.
sir. Thank you very much.